Hello guys, today we will discuss muscles of leg. There are four compartments in the leg: anterior compartment, lateral compartment, posterior superficial and posterior deep compartment. So we will discuss all the muscles in the leg one by one. We'll start with the anterior compartment. So this is a extensor digitorum longus muscle which arises from the lateral condyle of the tibia and the proximal surface of the fibula, including the head and the proximal shaft, and the anterior half of the medial surface of the middle 2/4 of the fibula. And then this muscle will travel anteriorly, and at the level of the foot it will divide it into four tendons, and then these tendons will go and insert at the base of the proximal and the middle phalanx. Then we have extensor hallucis longus muscle in the anterior compartment, which has a origin from the middle portion of the anterior surface of the fibula and the adjoining interosseous membrane. So this muscle will travel anteriorly and will insert at the base of the great toe. Then we have tibialis anterior muscle. So tibialis anterior muscle has a origin from the lateral condyle, the proximal shaft of the tibia and the adjoining interosseous membrane. Then this muscle will travel anteriorly and will have insertion at the inferomedial surface of the medial cuneiform and the first metatarsal bone. And then this is the last muscle of the anterior compartment, peroneus tertius muscle, which arises from the lower fourth of the shaft of the fibula and has an insertion over the base of the fifth metatarsal bone. So these are the muscles of the anterior compartment. Now we have lateral compartment muscles, peroneus longus, which arises from the lateral surface of the fibula, including the head and the proximal shaft, and then it will travel distally posterior to the lateral malleolus and will pass plantarwards inferior to the fifth metatarsal and in the plantar aspect of the foot, and will go and insert at the first metatarsal and the medial cuneiform. Then we have the peroneus brevis muscle in the lateral compartment, which has a origin from the lateral surface of the lower 2/3 of the fibula and will go pass posterior to the lateral malleolus and will insert at the base of the fifth metatarsal. So we know this is a very common cause of the avulsion fracture in the fifth metatarsal. Then we have the posterior superficial compartment, which assists in the knee flexion as well. So we have gastrocnemius muscle, which has two heads, which has origin from the medial and the lateral condyle of the femur proximal to the articular surface, and the two head will join and form the tendo Achilles, which will then go and insert at the calcaneal tuberosity. Then we have soleus muscle in the posterior superficial compartment. It has a origin from the this is a posterior aspect, so the posterior aspect of the head of the fibula and the proximal shaft of the fibula, and this is a soleal line, so has a origin from the soleal line, and we can see a gap there. So the neurovascular bundle will enter this gap, and this muscle distally will join the tendo Achilles and will insert at the tendo Achilles tendon. Then we have the last muscle of the posterior superficial compartment, plantaris muscle, which has a origin from the lateral supracondylar ridge above the lateral head of the gastrocnemius, and this will travel as a very thin tendon and will insert at the calcaneal tuberosity and into the tendo Achilles. Then we have the deep compartment of the posterior compartment, and this is a popliteus muscle, which has a origin from the proximal posterior aspect of the tibia proximal to the soleal line and will go and insert at the lateral femoral epicondyle. Then we have flexor digitorum longus muscle, which has a origin from this is a soleal line, so this is a posterior aspect of the tibia, middle 2/3 of the posterior aspect of the tibia, and then it will pass downwards, will pass into the tarsal tunnel, and after passing through the tarsal tunnel on the plantar aspect of the foot, it will divide into four tendons and then these 4 tendons will go and insert at the tip of the distal phalanx of the second, third, fourth and the fifth toes. Then we have the tibialis posterior muscle. So we can see that it has an origin from the fibula, from the tibia and from the interosseous membrane. It will travel through the tarsal tunnel, and it has an origin on all the tarsals except the talus and the calcaneum, and on the second, third, fourth and the fifth metatarsal bases on the plantar aspect. We can see that. So this is a last muscle of the posterior compartment, flexor hallucis longus muscle. It has a origin from the middle of the posterior aspect of the fibula, and will pass through the tarsal tunnel, will travel straight and has an insertion over the plantar surface of base of the distal phalanx of the great toe. So thank you guys. This was the muscle of the leg.